on that, call training and talk to John. He'll be happy to tell you. All right, so that takes us to our PPE for our EMS calls. I know it's kind of weird to talk about station cleaning stuff in more or less an EMS class, but it all ties together in the big picture. So PPE, things that we protect ourselves with. If you read the policy clearly states that on every EMS call you go on, you will wear your fanny pack, or the waist pack it's called. And first off, if you have an older, smaller fanny pack, where there's only one zipper on it, for example, you need to get that replaced because it's not big enough to hold everything that we're going to want you to hold in it. Secondly, if you're missing it, please get it ordered. Go through your battalion chief or the EMS officer and get that replaced. We did put a request out to have order a few extras for every station, so people that have kind of dropped theirs in skating, lost it, or whatever else, they aren't without having a fanny pack for the day if they work in a station that they need it. So what you should have in there at a minimum, what you see on your screen there, shows EMS gloves. Have multiple pairs of gloves, okay, for a couple of reasons. First off is, sometimes there's other people on scene that need a pair of gloves that don't have it. I've noticed AMR crews sometimes don't have extra gloves. Police officers on scene, they don't carry gloves. Sometimes they need them. So be the think about every call we go on. This fire department is considered the safety officer on every incident. So be a proactive safety officer and have safety equipment with you, and be willing to hand it out and share it. Have lots of gloves. The other next item is eye protection. Okay, and I'm recommending also, for the very same reason, have 2-pair eye protection. Okay, couple that with the fact that you could go on multiple calls back to back and not have a chance to get back to the station and disinfect your equipment. And yeah, eye protection is something that you need to disinfect. A lot of people forget that. A lot of the stuff that gets contaminated we don't see with our naked eyes. So you got to have that on. You got to wear it, and you got to disinfect it after you use it. The other idea with that is someone else may not have it on scene, and then you'll have an extra pair in your fanny pack to hand out. A lot of people, if you have prescription glasses, a lot of people think that prescription glasses fulfill the requirement for safety glasses, and that's not true. You are required to wear a ANSI certified eye protection that wraps around your eye that you see in the picture there. Next item up for discussion is the gown. Okay, you should have the blue gown, and you should have 2 of them, at least 2 of them. Probably 2 fits best in your fanny pack. But again, for the same reasons as mentioned before, you can share one, or if you go multiple calls without going back to the station to restock, you've got them with you. The N95 masks, we are recommending that you have about a half dozen in your fanny pack, because as you read through the policy, you're going to be using your N95s a lot more than you have in the past. A lot of guys are pretty good about wearing these when you go on people that are coughing and they're showing obvious signs of being sick. But if you read the policy, you will be wearing it a lot, which we'll go in more detail in a minute, but you're going to be going through a lot of N95s. We are working with the EMS officer to try and get a different product for the N95, one that has an exhalation valve, because as one of the most common complaints is that if you wear this N95 mask with eye protection and you exhale, it fogs up the glasses. And Training Vision's well aware of the problem, and we're working with it. So in the interim, please just wear your mask, and we're working on a solution. And then you also see a little bottle of hand sanitizer. Okay, you should have at least 1 bottle of that in your fanny pack and use it frequently. Again, we're trying to stop the chain of infection, stop that cross-contamination, and one way to do that is to constantly disinfect your hands. So, anyways, know your size on the N95, know your size on gloves, and restock your fanny pack readily. Other items that you just highly recommended to to have in your fanny pack is the small, one item I think is important is the small red bio bag. Because many times on scene, if one person in the crew or two people get blood or vomit on their hands and they got to pull off their gloves to put on new gloves, they're having to just drop it on the floor of someone's house or business that they're at, whereas if we have the bio bag handy, we can just keep things clean. Remember, we're trying to stop the chain of infection. So let's put the dirty stuff in the red bag, and if one's available, by having it in the fanny pack, it just makes everybody's job that much better.
Okay, so standard operating procedures. Infection control procedures and PPE are divided into 3 levels. So this is new, all right? And so we've done this to, this will make sense as we talk about it. But so level 3 is essentially what you've got inside your fanny pack. And Tony just covered that, very well. So level 3 is worn on all calls. All patient contacts got level 3. Gloves, goggles. Tony talked about, the upgrade in mask, for more different call types. And, the gowns, of course, as needed, right? Level 2, so this is a kit that we've got on the apparatus now. Okay, this consists of a higher level of protection than level 3. And we'll go over what's in that kit here in a little bit. And then level 1 consists of a response level that can only be authorized by the fire chief in response to specific threat or events, all right? And so level 1 is a biological, right? So that's hazmat team, right? So they cover the CBRNE stuff, right? Chemical, biological, so forth. Level 1 precautions are directed. The operations chief will develop screening criteria and a specific guide to the threat for protective actions and measures. And so, again, October 2014, we had the Ebola, right? And that's what the directive was about. But this isn't just about Ebola. This can be applied to basically any type of situation, where you have a lot of potential for like a pandemic. Like, for example, in the past we've had the bird flus, pandemic flus, stuff like that. So these are examples of when this level 1 precautions might be directed by the fire chief. So right now we are in a level 1 threat. That'll probably continue for a while. This threat of Ebola coming, showing up in a patient in the United States, whether it came from a caregiver or somebody that came here seeking care from one of these areas that are affected by Ebola. This will probably continue on for a while now. And so we have the CRESTA will authorize initiate the CDC procedures, all right? So Centers of Disease Control, right? So that's the type of procedures that are described. And the fire chief directs an end to level 1 responses based on information provided by the threat, okay? So we've had a directive issued. It's on Ebola response. It's ongoing right now. It has not been retracted. And so we're going to talk about that procedure here a little bit more. So level 3 PPE, right? Standard EMS incident. All personnel will don level 3 PPE prior to any patient contact. So medical gloves, right? That's standard. Eye protection, standard. N95 respirator mask, all right? So anytime you should be wearing a mask when a patient has suspected infectious or contagious disease, right? And so how do you know that? All right, well, presence of a fever, all right? That's a pretty good indicator. And then, some respiratory symptoms, right? So the and then anytime you're performing an airway procedure, right? So if someone's placing an ET tube, you're working at the airway, placing an OPA, stuff like that, you should be wearing a mask. Suctioning, should be wearing a mask. And so our scope of when we should be wearing a mask is what's recommended and what we're actually doing in the field. There's a pretty big gap there, okay? So caregivers in hospitals and so forth are transitioning more to use of mask on more call types because of the presence of airway hazards, right? So inhalation as a protecting against that route of exposure. So anytime a patient's receiving a nebulized medication, all right, so that's something that we haven't been in our work practices, haven't been doing. And this is not, so this is recommended now because the medication's actually breaking that stuff up, right? And so that room that you're working in, that nebulized medication, as the patient's exhaling, let's say you're treating somebody for pneumonia or something like that, they're getting a med neb. Well, that's present there in the air in the room that you're in. Okay, so mask is a good idea when you're running those call types. Okay, vax is required. So anytime call originates in a skilled or unskilled nursing care or nursing facility, all right? So the skilled ones, think PAC-SPEC, as a good example there, right? It's a lot of people on ventilators and stuff, and so those people end up with long-term chronic infections. Some of those are, MRSA, right? Respiratory MRSA. So we want to protect ourselves from stuff like that. And then anytime there's a reasonable anticipated risk of splash from blood or other potentially infectious material. Okay, so we're trying to protect our own mucous membranes. And so think of the patient that you're going on who's maybe got facial injuries, intoxicated or, a little bit agitated, right? And so, you got somebody who's cut around the mouth and stuff like that. And so they tend to spray as they're talking. And we've been pretty good about putting our goggles on for that, but we also have some exposed mucous membranes at our mouth, right? And so good idea to put a mask on that call type also. So anyway, we need to up our use of the mask. And then this plastic gown, anytime there's a reasonably anticipated risk of splash from blood or other potentially infectious material, right? And so we're trying to create a barrier so we don't want to get this stuff on our clothing and then because now we're contaminated and then cross-contamination, so you indirectly, touch yourself as you're heading back, and then you go to your eyes, your nose and so forth with your hands, right? And so that's kind of how things, this transmission of disease, that's kind of how it works. And you can put a patient on an N95 respirator mask, if required. So we had the surgical mask for that purpose as well, right? So N95s protects us from breathing stuff in. Surgical mask help with the person who's sick or whatever, and they're exhaling stuff out, right? So that's, again, another use for a mask. Level 2 EMS incident, higher level of PPE as needed, all right? So if you run this CDC call type, of course, you're going to go to level 2 PPE. Now, how this will work is if you don't identify this prior to making patient contact and you're on level 3 PPE, the person that's wearing the level 3 stays greater than 6 feet away from the patient. You say, hold on, we're going to be here with you briefly. And the other 2 crew members go back out to the apparatus and they don level 2 PPE, and then they come inside, relieve the person who was there as they go back, and they can start on the patient if they can. And the other person gets in level 2 stuff, and then they go in and start engaging patient care, right? And so, but this isn't just for these call types. You can choose to go to level 2 PPE anytime that you feel appropriate. So there are times when we get somebody who's significantly sick, and they've, let's say, examples of this are people who have those colostomy bags, and they break, and then they're obtunded, and it's been broken for a while, and then you have bowel all over the room as they moved around, and we're expected to go in there and remove that person from that area, treat them appropriately, and get them into the ambulance. Well, we're also expected to protect yourself from those types of exposures, right? So before you engage that kind of patient, go to level 2 PPE, get fully protected, and then, we got stuff we can doff and take off, and we're not wearing that stuff that's, potentially contaminated back in the apparatus and stuff, okay? And there's a proper way to take that stuff off after you have it on also. So remember, level 2 equipment is now available on all your apparatus, all right? And it's your option to go to it. and use it. Use it if you need to. Okay. Level one. Level one is the hazmat team. I think maybe Tony's on the hazmat team. He's a little bit more familiar with this, but
Yeah, so if you, level one is going to be for that patient that, let's just say, is identified as an Ebola patient, for example. Could be, a number of other things, but, Ebola is the hot topic right now, so we'll just use that. But there is a checklist that CRESA is using, and people that have traveled to West Africa, they know they are a potential at risk, and they've been advised if they have certain signs and symptoms that, if they're starting to develop those flu-like symptoms, that they're not to just go to their doctor, they're not to go to walk into the ER or something like that. They are being directed by the health department to call 911, identify themselves as to who they are, and that triggers what would be called now a level 1 EMS incident. And so you may be dispatched to this, and in which case, you run the call, but you're going to wear your level 2 PPE prior to making entry, and you're just really going to reconfirm what CRESA has already screened. You're going to do a little investigative work, and this is where one crew member in level 2 PPE will remain in patient communication, and you could do this from at least a 6-foot distance. Okay, other crew members will don level 2 PPE but remain outside the patient area. Okay, you can have the patient put on level 2 PPE as well. These are not going to be, so sick and infirm people that they can't function. They're not going to be bleeding out their eye sockets yet. Okay, these are people that they're just now developing symptoms. So you can give them the equipment and they can put it on. Okay, and that further insulates and isolates you from the infection. Crew members outside the patient area will begin designating a hot, warm, and cold zone for the incident. Okay, you really need to start thinking this is an actual, full-on hazmat call. So you're going to have control zones to establish. Okay, patient will be isolated and entry will be controlled. Okay, nobody other than that one crew member needs to remain in patient communication. Interventions will be limited to BLS skills unless otherwise directed by medical control. So with that stated, you got to contact medical control, let them know what kind of patient you're on the scene with, let them know that they are going to be put into the system as an EMS level 1. And authorized screening tool or checklist will be given additional direction based on the specific threat. You're going to want to notify your battalion chief what kind of call you're going on, and the battalion chief will tap out the hazmat team leader and initiate the hazmat response. The hazmat team will put together a 3 to 4 person crew that'll come, and the hazmat team will actually transport the patient in the back of an ambulance. AMR has a designated ambulance that actually looks like Dexter's kill room in the back of it, and it's all for containment and isolation. And we have a special CDC PPE that we have with PAPRs, and that's what we will wear. And we'll transport the patient to the hospital, and depending on which hospital we go to as to how long the transport will take. At that point, your hands will be washed of it, and you'll just need to go through proper doffing procedures of your level 2 PPE, and we'll go over that here in a little bit. But if you have any further questions on the level 1 EMS incident, refer yourself to the SOP, and or you can give any hazmat team leader a call, and they can explain it to you in more detail. And this is just this is the Ebola screening tool checklist that is part of the SOP. Okay, and these are the questions, honestly, that CRESA will ask the RP on the phone. So, does the patient have fever and or additional symptoms such as severe headache, muscle pain, vomiting, diarrhea, abdominal pain, unexplained hemorrhage, and they've traveled to West Africa, Guinea, Liberia, Sierra Leone in the last 21 days, or close contact with someone who has. Okay, that first part that could just be your average flu-like patient, okay? But the second half of that question is the key ingredient to step that up to the level 1 EMS incident, okay? There's been a few people that have said yes to both of the criteria thus far, and when a crew has responded and done further investigation, this is where I say you got to put your investigator hat on. You've done further detailed patient assessment. They found out that the individuals hadn't been to Guinea, Liberia, or Sierra Leone, but rather Israel and South Africa. A couple thousand miles off, but they were scared, and so it was a false positive. So anyhow, if both criteria are not met, treat it as a normal EMS event, whether level 2 or level 3. As John explained, the level 2 is going to be, when you got code brown, wear level 2. If it's not code brown, your level 3 PPE will be appropriate. And again, proper doffing procedures and proper decontamination always needs to take place. If both criteria are met, this is a positive screen. Again, contact your battalion chief and go through the chain of command and you'll get a hazmat response at that point.
Hey, let me add a little here, Tony. One other country's been added since this was made, which is Mali, right? And so the Ebola situation in West Africa there is ongoing, and it's dynamic. It has kind of tapered down a little bit, but it hasn't gone away. And I know you're thinking the probability of running into one of these patients would be very low, and it is. But there are people, from the U.S. that are going over there to help, right? So local missionaries and Doctors Without Borders, Nurses Without Borders, and other people, from different faith-based organizations. And so those people are also traveling back to the U.S. They're not there permanently, of course, right? And so these people are put on the watch list for 21 days. And so there's more travel going to this area than you might realize. And you're also very impoverished countries. And so the likelihood of people that are residents of those countries showing up at the U.S. is rather low because, they just don't have the economic means to do that. For the most part. But there's also missionaries and faith-based organizations of people that were there not necessarily for the Ebola, but also are from those countries. And as these people come back, they're put on this watch list, right? So they have to check in with the local health department. That's part of this whole process, right? The other one is now we're down to 5 airports of entry in the U.S. Well, 21 days is a long time, and that they still catch their next flight, to these other, where they live and stuff as they and they sit basically in semi-isolation, not really for this 21-day period of time, right? And they're watching for symptoms, and they're directed. Part of the plan is that they call you, that they don't just show up at the emergency department with these symptoms, right? Because they want to control what's going on here. So they're directed to call 911, and you're supposed to come in there and take them in isolation from where they live into the emergency department in this process that's been identified, all right? And so the chances are unlikely, but it's not impossible either, okay?
Okay, so initial screening, Crest will perform the initial screen of the patients by phone. They'll notify you on the MDC if the screen comes back high risk. And that'll be one of those little notes that pop up that, hopefully you see it pop up. There'll be nothing other than the word high risk come across your MDC. Crest will initiate what they call a CDC response, and they will advise the caller that the crews will be putting on PPE prior to entry. So don't, once you kind of park the rig, don't feel like you need to go in and hurry to get inside. Take the time appropriate and put on your level 2 PPE and prior to entry. And again, one member stays in communication with the patient. Everyone else initiates level 1 procedures. Okay. All patients should be screened by crews on arrival. Okay, this is just that investigation that I was talking about. Just reconfirm what CRESA has identified. Because knock on wood, thus far, nothing's come up a full positive yet. Okay, the other thing to keep in mind, okay, this is kind of like a fog, if you will. Treat the call as a hazmat event. Isolate the patient. You're going to isolate and deny entry, just like any other hazmat call. Remember that others in the area may need to be quarantined, so don't let just anyone all kind of take off from the scene. Keep them at the scene, but out of the immediate isolation zone. Explain to the patient what is occurring and why it's happening. They may not, even though they were on the watch list and they know they needed to call 911, they may not fully understand what all is going on. You have your level 2 PPE on, stay in communication with the patient, give the patient level 2 PPE to put on, and then contact med control, and again, limit patient care to BLS unless medical control tells you otherwise. And really that would be, the extent of that would be to give Zofran IM, just to minimize any nausea and vomiting. Okay, so we're going to get into donning and doffing of personal protective gear.
Okay, yeah, so CDC, of course, is this donning and doffing of PPE, became more, kind of came to the forefront as basically from the Ebola. Because like I said, Ebola is one of these envelope viruses. And so a characteristic of an envelope virus is that it'll live on surface areas for a long time before it dies. And so although it's not airborne, it has some qualities that can make transmission possible if you're not careful, okay? So donning and doffing of this gear actually matters and how you do it. Okay, so they've had some additional recommendations, as time went on early on, because some of these people that did show up with Ebola were wearing PPE, and they're trying to figure out, well, how did that happen, right? And so, and your most likely place that you're going to cause, where you'll contaminate yourself, and this is a form of cross-contamination, is actually taking the equipment off, right? Because now you get it unknowingly on you somehow, and then you indirectly or unknowingly, maybe you go rub your eyes or something like that, and then you've introduced it into your, so although it's not airborne, like norovirus, and then again, think cruise ship, right? So, and the type of cleaning that they have to go through when they have one of these big events at a school, one of these cruise ships or residential care facilities, right? It's because it's the quality of this type of virus, and its ability to live on surface areas is the main concern, right? So as you can see, this whole thing kind of ties together, as far as the disinfectant we use, how you use it, the whole deal. So we're going to kind of go over this here to some detail. Selection of PPE